Good morning to all those who help us with this briefing. Good morning to Gisela, who is in the studio. And good morning to our daily audience. We begin this briefing today with the good news that we have an additional day where we have we begin this briefing today with the good news that we have one more day without reporting deaths in our country. By 12 midnight, there were 817 patients admitted to the hospitals, the lowest figure we have had in recent days. In surveillance, 12, suspects 559, and 248 confirmed cases. In observation by our primary healthcare system, there are 889 people. 1,732 samples were studied to diagnose COVID-19. In the molecular biology laboratory of the Pedro Curie Institute of Tropical Medicine, 766. In the laboratory of the Provincial Center for Hygiene and Epidemiology in Santiago de Cuba, 320. In Villa Clara, 237, in Havana, 188, and 221 in the laboratory of the Brothers Ameijeras Hospital. As a result of this study, 13 samples tested positive to COVID-19. In this way, Cuba has the cumulative total of 87,288 samples studied, and as a result of this, 1,900 people have been diagnosed with COVID-19. This represents 2.2% of the samples studied. The 13 new cases confirmed yesterday, they are all Cuban. 9 are contacts of confirmed cases. Thus, in the Cuban epidemic, 1,600 confirmed cases have been contacts of other previously confirmed cases for 89.2%. Yesterday, in 4 of the 3 confirmed cases, 30.8%, their source of infection could not be specified. The epidemiological history is being investigated and completed, but up until last night at midnight, there were 4 cases. Cuba has a total of 68 of such cases. In some of them, the source have been identified, but nonetheless, in 3.6% of the cases, the source of infection could not be established. With the source of infection abroad, the figure remains unchanged at 131, which represents 7% of confirmed cases in Cuba. It must be said that there is one patient in the Playa municipality that was confirmed as a result of the population study that is being carried out in our country, of which we have seen footage, we've seen the images. This is a patient who was asymptomatic. He was included in the study, and well, he was confirmed yesterday. This is the importance of this study, because we are finding people who have the virus, who spread it, who have a risk for their health and for the people they contact. Its detection allows us to isolate the person epidemiologically, to detect all contacts, to isolate contacts, to study the person, and to complete all the research with each of these cases. Yesterday, of the 13 confirmed cases, 4 are of the female sex, of 30.8%. In the accumulated total, 929, that is 48.9%, of the people who have been confirmed in Cuba belong to the female sex, and 9 of yesterday's 13 cases, 69.2%, are of the male sex. And we have said of these days, the greatest number of people diagnosed in our country are of the male sex. In this case, 51.1% for 971 people. 65.1% of the cases diagnosed yesterday, 8 cases are totally asymptomatic, including the one we referred to that came out of the population study. Thus, there are 951 cases, which represents 50.1% of the cases confirmed to date. 50.1% of the cases confirmed in Cuba at the time of diagnosis were asymptomatic. By age group, there are 9 under 40, that's for 69.2%, and 4 between 40 and 60, that's 30.8%. Among the 9 under 40 years old, there are 2 children. One is 80-year-old, an 80-year-old, and another one is a 12-year-old. They are contacts of a positive case and were detected yesterday. I insist that all the children diagnosed in our country, including the 2 that were diagnosed yesterday, have had a stable evolution of their illness. By province, 8 cases, 61.5%, are from Havana. In the case of Havana, 1 is from Centro Havana, 1 is from Old Havana, 2 from Playa, 2 from Arroyo Naranjo, and 2 from Cerro Municipality. 5 of the 13 cases confirmed yesterday come from the province of Matanzas. In this case, 3 are from the city of Matanzas, the municipality of Matanzas, 1 is from Cardenas, and 1 is from Calimete. Up to 12 o'clock last night, of the 1,900 patients diagnosed, 246 remain admitted, of which 238 have a stable clinical course. We're talking about 96.7% of confirmed cases who are admitted to our hospitals. We regret the 79 people who have died with this disease in our country, which gives a lethality of 4.15%, and we always compare this with the behavior in the region of the Americas, the one we belong to. The lethality in the region is of 5.94%, and Cuba is in the 15th place with a rate of 4.15. We have the 2 foreigners that were evacuated at the beginning of the pandemic. 35 discharges in the day. Again, we continue to have a positive balance, more discharges than the number of confirmed cases. And in this way, with the new 35 discharges, there are already accumulated 1,573 people who have had the disease in our country, who have recovered and are today discharged. We are talking about 82.8% of all the positive patients. We have to report 2 patients in critical condition and 6 in serious condition, 1 more critical than yesterday and 1 less in serious condition than yesterday. In the world, the 185 countries with confirmed cases of COVID-19 remain, with a cumulative total of 4,766,468 confirmed cases. We're talking about 86,957 confirmed cases yesterday alone. And more alarmingly, a total of 318,201 deaths, which represent 3,196 in yesterday alone, with a lethality of 6.68%. Today we saw in the morning news from Telesur that in Brazil, yesterday, in a single day, there were 1,000 deaths from this disease. In the region of the Americas, 2,134,455 confirmed cases have already been reported. Yesterday alone, 46,357 cases were confirmed. The number of confirmed cases in the region of the Americas now represents 44.78% of the world total. And yesterday, there were 1,970 deaths for a total of 126,832 in our region, with a lethality of 5.94%. And this is our information we had to give you today with the data from our country and the world.